Welcome back to Health Digest, and we are having a conversation on drug use and abuse among the adolescents and youth. And just before the break, we are looking at issues of drug use and their effects, and obviously the issue of addiction and rehabilitation. On my panel today is Tina Masai, who is a clinical psychologist, Patricia Kwamboka, who's a project manager at Dagoretti Child Protection and Development Center, and last but not least is Susan Maua, who is the acting manager, public education and advocacy at NACADA. And I'll start with our audience.
There's a saying that goes around that the police cannot find a weed dealer and a 15-year-old can, you know. But my concern won't be on the weed dealer. It will be on the drugs that are legal actually in Kenya, like tobacco. I have witnessed in my area, I live also in ghetto, and I've seen young people who, let's say a 10-year-old is being sent by the mother, go buy me 2 cigarettes. The shopkeeper will give her the cigarettes, and we know very well that the Constitution has stated that tobacco is not to be sold for people under 18 years. So that young person will take the advantage of the situation and buy 3. 2 for the mother and 1 for herself. This is a really, really discouraging thing in my area, which I even see 9-year-old boys smoking weed, taking cat, and it's really discouraging, and I wish that NACADA can see this, the government as well, and all the organizations that work with drug and substance abuse, so that they can see through this and even work with these shopkeepers and these people who sell tobacco.
I don't think that drugs start innocently all the time, although partially that is true. I believe, as mentioned by your panelists, that poverty among with other factors cause drugs to not start innocently. They don't have an escape. There is a lot of mental health issues that are involved with taking drugs. And also, you mentioned that genetics play a big part in addiction, which is true. However, to get genetic testing, it costs a lot of money and a lot of resources, which a lot of countries, including the US, which is where I'm from, don't have. So I think a major issue that should be brought up is adequate funding for not only resources, but mental health resources, because these 2 issues fall hand in hand.
We started by what is addiction. So I have a friend of mine who started smoking, and I asked him, what made you start smoking? He was like, you know what, I had pink lips. So I started smoking so that my lips can turn to, as in it can turn color to black. I was like, really? And up to now, as we're talking, he can't stop smoking. But if you go back to his story, he started smoking because he was not addicted. He was not. Nobody pressured him to start smoking, but because of what he felt like, maybe I want to change my lips. And another point I want to bring across is sometimes you find young people. Maybe you have a small migraine. You're like, you know what? I feel like I'm sick. Let me go for medication. Maybe you're just hungry. Maybe you're just tired. Just take a nap, eat something, and voila, the migraine will go. So we as young people, we should not, like, anytime you feel like you're sick, you just go for medication. You go for medication. For instance, you have something called codeine syrup. We find that it's a syrup. It's not a drug, but the moment you take it, the more you take it, the more it brings effect in your body. So anytime when you feel like you're sick, don't go for medication first. Just check yourself. Maybe you're just tired.
So I'd like us to comment, and I'll start with Susan, on the issue of drugs being sold to underage.
When we talk about drugs, it is good she has mentioned that our biggest challenge is actually the legal drugs and not even illegal drugs. Although sometimes people want to focus more on illegal drugs rather than the legal ones, and the first one being alcohol. Then we have tobacco, and we have various forms of tobacco, because even Kuber is one of the tobacco products. Now we have, from the research, we have prescription drugs is also coming in. Then we have Mira, and cannabis is actually number 5. If we look at studies on primary and secondary schools, cannabis is number 5. So we're actually talking about what is readily available. Now, I would say that I think our society has gone bad, because before, it would not be very easy for you to, for example, sell alcohol to a student in uniform. Even if they were above 18 years but they're in uniform, there was that sense of responsibility. But today, I think people focus more on money, and that in itself has made us not really think about the next generation.
Patricia, the issue has been revolved, or rather Tina addressed it and she raised it on using drugs innocently, that it's not so innocent after all, that we have all these other issues of poverty or lack of resources that are fueling and driving people into drug use. Is this what you see at the Child Protection Center?
My experience is working with street children and with children who come from informal settlements. So, and that is why their experiences with drugs that they can afford, the inhalants that are accessible to them, and they are not illegal because they're industrial products. Petrol you can inhale petrol and get high. Paint thinner, you can inhale and get high. Nail polish remover. It's a wide range of things, including what now everyone knows, the glue you use for the shoes. Those are things they can afford. They work in the market, they beg or steal, and they'll be able to buy it and get the high they need. The unfortunate thing is that actually, unlike all the other drugs that you can get rehabilitated, with inhalants, they actually mess up your body. And you may not be able to be rehabilitated from the effects. However, they are very easy to quit. If you get into a program like what we have in our center, which is a schedule of activities from 7:30 to 5 in the evening, and you're away from it, it gets out of the system.
When you say they mess up the body, what specifically does it do to these young people's bodies?
What happens is you'll see a young person or a child who has been inhaling glue for a long time will be swollen. So you'll have the internal organs, because it's a chemical called toluene that they are inhaling. So the internal organs are getting destroyed. And once the destruction has happened, you cannot recover from it. So even if you're rehabilitated, if you've been taking it for 3, 4, 5 years, when somebody looks at you, they can tell your body has really undergone a lot of damage. Yeah.
Okay. Where do these young people look for help in that case if they are struggling with substance use? Where is it that they can get help?
There are a number of resources available. I think one of the lowest hanging fruits, as has been mentioned by one of the panelists, is the hotline that NACADA has. It's possible to get in touch using the 1192 code and reach out to available counselors. There are also a number of existing rehabilitation facilities, inpatient, all over Nairobi. NACADA also has a comprehensive list of rehabilitation services. For people who inject drugs, there are about 6 or so facilities all over Kenya that provide services. We have 2 in Nairobi, 1 in Mathare and Ngara, that provide services for people who inject drugs, and specifically heroin. It's also possible to reach out through psychiatrists as a first step, and some are capable of managing inpatient, some are capable of managing outpatient. So there's a number of resources that exist. There are also a number of community interventions, drop-in centers, where we have at least 4 or so in Nairobi. One of them, NOSET, that is based in Ngara, where people can reach out for drug-related services. There's also SAPTA. They have one in Ngara, in Pangani, and another in Kayole. We have MDM, Médecins du Monde, who are based in Kawangware, who also provide those services, community level.
Okay. I'd just like to ask the young people here, what is your experience when you reach out, even to the 1192 if ever? What is the experience in reaching out to these designated persons for help? Is it youth-friendly?
I have a friend who was having an anxiety attack and she didn't have her medication. So I gave her the line and she called, but no one answered. So she attempted suicide and she didn't get help. Yeah. So I know anxiety medications are also part of those drugs as well, because I also have an issue with migraines. So I take a medication that's really addictive. Even though you can get it off the counter, now you can't, because a lot of people have started finding out that that medication is addictive. So for us who have that challenge, it's a bit hard. Like, you actually have a problem and you go there and you try and ask them, but they'll look at you and like, no, this one wants to abuse, you know?
My experience initially when we first went to look for health services was extremely, let me just use the word terrible, because it turned us back. When they saw how we looked, first of all, I'm clean right now, clean inside and clean outside. But normally when you see a drug user, especially somebody using hard drugs, they are dirty. I might be educated to the end of the world, but you might not be able to tell exactly what I am. So when we went to the health centers initially, this is before these wonderful people ever came into the picture, there was a lot of stigma. We would be asked, first we went to our religious centers, because in Mathare we had a system where the Muslims would help their people, the Christians would help their people. We went to the religious centers, we were turned away. So we went to the nearby health centers, and even there, nobody really wanted to get involved with drug issues. One, because of ignorance. You know, you tell them heroin, they don't know if it's contagious or what is going to happen. Also, just the way we looked, the way we presented, we had lost our sense of direction, couldn't be able to articulate. So as much as there have been strides in sensitizing health workers, to this point, health workers have been sensitized. At least now they know about these things, but we still have a very big problem. In my university, specifically, we have a very big problem. It's difficult for you to go and say that I am using drugs, and for it not to be a big church maneno that so-and-so is using drugs. So we really have a very big problem in how we talk to our kids on the same.
I would say basically accessing help has been a challenge. For instance, imagine this young person who needs to access a mental or a rehab. Basically, MTRH currently, because I've worked with MTRH, the rehab in MTRH, just being admitted for 1 month, it's 30,000 shillings for a rehab. And you have to be there for 3 months. That's 90,000 for you to be admitted. This young person who needs not to disclose the issue to their parents need to access the treatment. They can't afford 10 shillings to access Kuber. But to be accessed in the mental health rehab sessions, they have to pay 30,000 shillings per month. The other challenge is how many psychiatrists do we have in Kenya? And accessing a psychiatrist peke yake is a challenge. Mm-hmm. And you are expecting, let's put it, a young person to access these services. Even if I have the call, but there are some situations which need psychiatric evaluation for you to be evaluated and be maybe given the right treatment, psychotherapy or pharmacotherapy. Are you able to access this as a young person who is not even able to go to school? Rita's story. How is she able to access these services?
Just to wind up, I asked that particular question because most of the time when we have all these conversations, accessing health is a problem, and even when you access, the kind of reception you get really is not conducive for you to continue, and yet these are people who need those services. So from your different platforms, NACADA, Child Protection Center, and you deal with people who use injectable drugs, how can this be changed so that these people can come out and get the help that they need and that you have capacity to provide?
I think 1192, the reason why 1192 came into being is it works 24 hours and it is also free of charge. So it means that wherever somebody is, they can actually speak to somebody. And just like any other helpline, you can call the first time and the caller is on another one. So it means that you need to try another time. You don't just call once and leave it at that. I would attest that now the software has actually been upgraded so that if there's a missed call the person who is on the counselor could actually call back, because previously they would not be able to call back. Now they can actually call back the person who was trying to reach them while they were speaking to somebody else. And I can tell you there are people who have got that help, because telephone counseling is brief intervention. So it means that you can actually speak to the same counselor over and over and over. And this counselor can also refer you to a physical facility if need be, and they can also make a follow-up. So that is one thing that would actually cover the whole country. Now, if you're in Nairobi, there is actually a youth-friendly center at Kenyatta National Hospital. I know people may not be aware of it. I've been there, and I can tell you that youth get served. We are talking of people 24 years and below. They actually get services there. So if you are within Nairobi, and I've seen even people from outside Nairobi being sent to the youth center. So it means that you can actually access those services. So at least those are two areas that I can attest to. And I know that rehabilitation is expensive, although right now NHIF is also paying, but not fully. And then the other challenges that probably Tina will tell you is relapse. Yes, you spent 90,000 shillings, and as soon as a person gets out of rehab, then they relapse. And the family gets discouraged, and the person, and so many other things. So that is why prevention then would be the best option for the young people.
For me, I mean, the treatment is actually not very easy for children to get. A lot of people assume that children are not addicted to drugs and substances, and actually categorized as users and abusers of drugs. But we have a very small percentage who have actually moved into addiction. And what we do in the center that we have in Dagoretti is that we provide access to psychosocial support and rehabilitation using theater as a way of expressing, because sometimes you find it's those issues that they are having, they're not able to cope with, they're not able to talk to somebody, and providing them with a safe space where they're able to express what is going on in their life and getting the help that they need. In addition to that, a good prevention program that has a lot of education, raising awareness. I like what the young man talked about, his mother was able to educate him. A lot of the times we spend a lot of time educating the children, and we forget that the parents actually don't have this information. This goes even to pregnancy and all those other things, because when they grew up, that information was not available to them. So also, these programs should also target parents as a way of also empowering them to be able to talk to their children and to reinforce what the teachers are giving, what social workers, counselors are doing out there. And then churches are also important for this, and the religious institutions to provide information in a way that is age-appropriate, friendly, that is not putting people off.
That does not stigmatize.
Yeah, and does not stigmatize, such that people don't come out when they are faced with that problem. Because as young people, we experiment. And that is how we learn lessons in life. But sometimes, like she said, you'll be crossing the road and you may not reach the other end, or by luck you reach the other end. So having people who can walk with you with your eyes closed, maybe because them they've experienced, is useful. So role models, having a good awareness raising, and providing information in a way that is friendly to children and young people will give us good results.
I feel like a low-hanging fruit is definitely the community-based, preventive community-based interventions. So whichever community we exist in, if we come to a place where we have those resources embedded, just as she said, in the not just in the hospitals, in the churches, in community centers, any community activity where the youth can just come freely and see, hear, talk, maybe even engage and interact with people who have gone through that journey, I think that's going to be a great start. Again, the cost, changes are happening in the country to try and make health services more affordable. I agree that NHIF is the way to go. Even for youth, perhaps educating yourselves on how much it costs to have an NHIF card. What kind of payments do you need to make? If I had a mental health problem or a drug use problem too, where can I use my NHIF card to access? Because they've done their best to make some of those services come closer to us and become more affordable.
Thank you very much, ladies, for having this conversation with us on drug use and abuse. We've been having this conversation with, to my immediate right, Tina Masai, who's a counseling psychologist, and she works with people who inject drugs. We have Patricia Kwamboka, who's the project manager at Dagoretti Child Protection and Development Center. And last but not least is Susan Maua, who is the acting manager, public education and advocacy at NACADA. If you need any help for any issue that we have discussed on this particular topic on drug use and abuse, the helpline for NACADA is 1192. It's free, and you will get a counselor and you will get the guidance that you need. And if you need any referral, they'll be able to do that. But we also have, as Tina had said earlier, various centers and various facilities that can attend to your needs. So do not suffer by yourself when help is available, and reach out. There'll be people who can assist somebody you know, or if it is you who needs this help. That's where we end this discussion on drug use and abuse among adolescents and youth. We'd like to hear from you. You can get in touch with us with any of the lines on your screen. You can tweet me at Dr. Mercy Korir, at KTN News KE, or you can send us an email at healthdigest@standardmedia.co.ke. I leave you with this week's Patient's Diary. I'm Dr. Mercy Korir.
Soi area was in Gishu County. We meet Mary Cheruto in the sleepy village of Kongoni. Mary suffers from a strange disease which has left her confined to her only earthly possession, basking in solitude. Mary, an outpatient, underwent Doppler ultrasound at Moi Teaching and Referral Hospital in Eldoret, which showed she had lymphedema. Lymphedema is a chronic long-term condition that causes swelling in the body's tissues. It can affect any part of the body, but usually develops in the arms or legs.
Sasa hospitali referral nitakana kupasuliwa. Mimi sina mbele wala nyuma. Enye watu walikuwa wamechanga kidogo, hiyo ndio ilienda ikaisha huko mapicha manini na ikaisha hivyo. Nikarudishwa nyumbani. Kuna vile naweza. Naomba tu kweli serikali waingilie kati, wanisaidie tu kweli, nitoke kwa hii ugonjwa, nifanye tu shughuli zangu vile nafanyanga kawaida. Naomba.
The long-term condition has caused her discomfort, pain and loss of mobility. This day when KTN News crew visited her home, she had swollen leg and fell down the previous day as she attempted to walk by herself in the neighborhood.
Nashika hiyo miti, kuna kumiti kuku hapa nilikuwa nakashika hivi, lakini hata kutoka peke yake hakuna. Sasa hiyo mama walikuja wakinisaidia, wakinitoa nje, wakinirudisha ndani. Kwa chakula wanaleta, sina kumuti yangu, hata ukule nyumbani sina msasi, wote walikufa.
Amekuwa akiumia, alikuwa akitembea akiumia, lakini ilifika pahali ikamzidia.
Nilipigwa picha na ingine akapewa madawa ambaye alikuwa anatumia kwa ajili ya uchungu, na igawa hiyo madawa imeisha, na vile imeisha uchungu imezidi.
Doctors say lymphedema can't be cured, but it can be controlled using a number of treatments, including compression stockings, skin care, lymphatic massage and elevation.
Ndio tumekasa, tumeona hali hii iko inanipeleka vibaya, inanishika tu mkongo, silali usiku. Silali usingizi tu, macho isinike hivi. Yani ninaumianga usiku yote na sina mtu kwa nyumba mwenye ananisaidia. Tunakaanga nao wamama wakifika jioni, si ni watu ya manyumba zao wanaenda kushughulikia watoto. Sasa usiku mimi napakingi tu hapo peke yangu.
Mary was due for surgery last month, but she didn't make it. Mary, who hails from West Pokot County, has no relatives. She hopes one day her future will be secured. Elvis Kosgei, KTN News, Kongoni area, Uasin Gishu County.